Good afternoon, everyone. I want to acknowledge our Public Health Commissioner, Dr. Allison Harwoody, who's with us here today, along with our Commissioner of Business Affairs and Consumer Protection, Rosa Escareno. Earlier this week, we shared some of the very troubling COVID-19 data that we've seen in recent weeks. In announcing that data, I said that if we don't see a dramatic turnaround, and soon, then we would not hesitate to take the steps necessary to keep our residents safe and healthy. At that point, just a few days ago, our average daily rates of new cases had reached 500, marking a more than 50% increase since the beginning of this month, and the highest daily rate that we'd seen since the tail end of the pandemic's first wave back in May. It also coincided with a worrying increase in hospitalizations. Since we made that announcement just 4 days ago, our city's daily COVID case rate has now surged and reached over 640 cases on average a day. We are, no doubt whatsoever, in the second surge. This is what it looks like. And due to this latest increase in numbers, I, in consultation, of course, with our public health experts like Dr. Harwoody, will be putting in place a business curfew for the city of Chicago over the next 2 weeks in hopes of stemming the spread of this disease. Now, we've reached out to business and community leaders in advance of today's announcement, and we will lean into further engagement with these groups who have been invaluable partners and, as you know, have been severely impacted by COVID-19. A business curfew means the following. Effective tomorrow, all non-essential businesses will be closed to the public from 10 p.m. to 6 a.m. All liquor sales will be closed as of 9 p.m. across the city. That's restaurants, cocktails to go, and any other alcohol sales stop at 9 p.m. And as with the first surge, exceptions will be made for our essential businesses, like grocery stores, pharmacies, and restaurant delivery and takeout services. Meanwhile, bars that don't operate with a food license will no longer be permitted to serve customers inside. And finally, I want to make a special point on this. We are asking all Chicagoans to refrain from gatherings of more than 6 people, as well as social gatherings of any sort after 10 p.m. And we are taking these measures to avoid potential catastrophic impacts later. As we're all aware from the daily headlines, the rapid rise in cases that we're experiencing here in Chicago is consistent with what we're seeing not only across the state, but across the nation and in many other countries around the world. This is what public health experts and responsible leaders have unfortunately been forecasting for months. And the reason is simple. COVID-19 thrives in places and in circumstances where people let their guard down. And as the weather cools and people move indoors, the risk of the spread rises exponentially. That's why we have been preaching about limiting the size of gatherings, about wearing a mask everywhere you can, and particularly outside when you're socializing, you're coming into contact with other people. However, compounding all of this is reports that we're now seeing uptick again of large groups of people gathering without social distancing and worse, without masks. Now, some of it, of course, is a misplaced sense that that those you know don't have it. That's wrong. Some of it is COVID fatigue, which we get. But some of it is just simply being irresponsible. Whatever the case, the fact remains, we have to wear masks. We have to social distance. We have to engage in hand washing and all the other socially responsible public health guidelines that we have been talking about since March. We have to remain vigilant. COVID-19 has not gone away. It has not disappeared. We're not out of this crisis and this pandemic. It is very much part of our present. Now, I know that you all have made a tremendous number of sacrifices, really going back to the spring. Everyone's world has been upended. And it's tough to think about some uncertain future where we have to remain as diligent and making the kind of sacrifices that we've made all along. But I'm here to tell you, there's no other option. It doesn't exist. If it did, we would be talking about it. We would be promoting it. It doesn't exist. We all have to use the tools that are available to us now and take advantage of the opportunity for ourselves, for our families, our friends, people in our network, but also our neighbors across this city. Let me also just say that we as a city workforce need to be better ourselves in mask wearing. This includes our public-facing departments and agencies like police and fire, as well as streets and sanitation. And we are asking our commissioners in those departments, but truly in every city department, to build updated strategies to ensure that your workers get the message. They must wear masks. And if they don't get the message, you need to take decisive action, up to and including discipline. I've asked the inspectors of the Chicago Police Department to start ensuring folks in every unit across the city wear masks. And where they fail, the time for educating people into compliance is simply over. If you're an officer, you're a fireman, paramedic, if you're a city employee, I'm telling you now, as your mayor, as your boss, you must wear a mask, period. Throughout this crisis, we have worked to be prudent in reopening our city. We worked to use a dimmer switch and not a light switch. And for much of the summer through August, we did well. We didn't see the surge that many had predicted. But we had a problem in August. We jumped on top of it, and we were able to see case counts go down in September. But now we're at another inflection point and another challenge. And we have to be just as diligent now as we have been all along. We have to dig down deeper. This is a critical moment for us, and it's really going to determine what we all are experiencing for months to come. I cannot understate and underscore that enough. What we do now will make the difference between what our future looks like and what it could be. Whether or not we are a city that is, again, a model for the nation, or whether or not we're going to be another data point on the spread of COVID-19 that seems to be spiraling out of control. You, each of us, have the power in our own hands to write our own destiny, our own narrative, but it has to start now with getting back to basics. Wearing a mask, social distancing, limiting crowd size, and not allowing non-family members, people who are not in your bubble, into your homes. This virus is relentless. It doesn't respect our boundaries. It's not something that we can keep at bay when we're in our home. It isn't. We've got to be diligent every single day. And again, it starts with the actions that you take, that each of us take individually, to help our city get beyond this terrible surge in cases. Dr. Arty will provide more details in a moment, but the rising case numbers we're seeing are happening across the board, across every zip code, every demographic, every age group. The curve is going up again. If we pretend to know that COVID-19 isn't the deadly virus that it is, the result will be more sickness and more death. And Dr. Arty will detail this in a moment, but we are starting to see that uptick in hospitalizations that we're all concerned about. That's a lagging indicator, but what it means fundamentally is if people are getting sick enough to go in the hospital, they're going to move from the hospital into the ICU, and from the ICU onto ventilators. And what that means is that there are going to be a certain percentage of those folks who die. Our death rate has gone down significantly from what it was. We do not want to see more people lose their lives to COVID-19. And while I'm up here, I also want to say again a message to our young people. You've heard me say it before, but I'm going to say it again. You are simply not immune from COVID-19. You can and you are getting it. And your numbers of infections are going up again. 18 to 29, 30 to 39. Your rate of increase is alarming, and you need to take heed. And you need to wear a mask. You need to be better equipped to overcome this surge, but you are still spreading it to those who aren't. And this has to be an all hands on deck moment for all of us, but especially for you, young people. What none of us want is even further restrictions as we move into the holiday season, impacting Thanksgiving, Hanukkah, and Christmas traditions. But that is exactly the path that we are on right now if we do not take heed and adhere to the tools that got us to a better place in the first place. Now, I've said this before, we're taking these steps now. They'll go into effect tomorrow. But if we need to take further steps and move back into phase 3, or even going back to shelter in place, I'm not going to hesitate to do that. I hope that won't be necessary, but it's all in your hands. It's all in your hands. To keep all that from happening, we need to also be limiting the number of people we come into contact with on a daily basis. The more people gather, the chance this disease spread increases exponentially. And I know that's easier said than done for many, our essential workers, and particularly those in our Latinx and Black communities. And we will continue to be reaching out and supporting you in every way that we can. We understand how disproportionately you have been affected by this terrible, terrible disease. But I want to emphasize the one thing that each of us can control is who we come into contact with, who comes into our home, how many times that we're out in public. That has got to be something that we think more seriously about as we see this second case surge happening. I don't want to put more restrictions in our city. No one does. But I have to do what's right to save lives. And if that means rolling back further, I will. My friends, we have to be in this fight together, because together is the only way forward and through. Together means that we are working hard as individuals, as family members, as neighbors, together to really fight this virus with the tools that we have at our disposal. Wear a mask. It's that simple. It's not a political statement one way or the other. It's a public health statement. It's about saving your life and saving the lives of people that you come into contact with. I urge you, I beg you, to take this case surge seriously. It is frightening. The rapidity with which these numbers are doubling on a day-by-day basis, that the increase is startling. It's really quite breathtaking. If you think about where we were just 2 weeks ago, or even at the beginning of October, and where we are now, it's like we're back in the spring. So folks, we've got to do what we know that what works. Social distancing, wearing a mask, washing your hands, and limiting your contact with others.